Thank you for joining us and staying with us on Health Matters. I'm Dr. Mark Castellaw. Our program today is about the heart, and we're having specialists, we're having patients on the show today to tell us about their experiences with coronary disease. Do you know that people that have heart disease, 1 out of every 4 can die of a heart attack? And also another startling statistic is every 25 to 30 seconds, someone in the United States is having a heart attack. So it is so important for us to understand the signs and symptoms of coronary disease. Well, my guest now is Dr. Jerry Gooch. Dr. Jerry Gooch is a cardiothoracic surgeon with Baptist Medical Group. Thank you for joining us, Jerry.
You're welcome.
Now, Jerry has incredible experience. He's one of the foremost surgeons in the Mid-South, and we're so fortunate to have him today. And actually, if you've been watching this entire segment, the patient that we had earlier today, Mr. Jim Sykes, Dr. Gooch was the one that operated on him and repaired his blockages. Now, Dr. Gooch, we talk about bypass surgery. What does that mean? What is bypass surgery?
Well, bypass surgery is really literally just taking a vein or an artery from the patient and going around, bypassing around the blocked artery. Where a stent would be taking a balloon and opening up the small area and using a little coiled metal to keep that open. Bypass is, if you can imagine, something like biological plumbing, where we took a vein and just went around the block from an area where the artery was normal to another area where the artery is normal and go around the blocked artery.
Now, what determines when someone needs a bypass or someone needs a stent?
That's really determining the anatomy of the heart. Some arteries are better to stent in the anatomy of the plaque or the blockage. If it's a short blockage, it's fairly easy to balloon and stent, and if it's a long area of narrowing, it's much more difficult. Most patients, if they have 1 block or at the most 2 blockage, might be a candidate for a stent. If any more than 2, certainly most people would be candidates for bypass surgery.
Now, what are some of the statistics about the survival rate of bypass surgery compared? Now, bypass surgery first started when? In the early what?
It was like the mid-60s, 64, 65. Actually, Dr. Garrett, one of our pioneers in Memphis, performed the first bypass when he was in Houston with Dr. DeBakey. And it just accelerated through the 70s and 80s, and still very similar to the same procedure done today, with the addition of some minor technical changes.
What are some of the statistics now that with people that undergo coronary artery bypass?
Well, today the risk is around 1%, both actually for a stent or bypass. And that's a 1% chance that anything really bad would happen. You die, have a stroke, have an infection, any major complication is relatively low.
So there's been major progress in coronary artery surgery.
Absolutely, and it's done very commonly with a very low risk and a very rapid recovery in most patients.
Now, walk us through, Jerry, a little bit about a bypass. If we've had a heart cath and the cardiologist has consulted you and you've come in to see the patient and it looks like they're going to have surgery, what's the procedure? That's a scary thing for someone to look you in the eye and say, you're going to have a bypass. So tell us what happens.
Well, during the surgery, we take a vein from the leg, and most of the time now we can take that with a scope, like gallbladders are done through a scope, and that's one of the major advances in technique today that can be done endoscopically, we call it, on a TV camera, and take with just a small incision on the leg, we can take out the vein from the entire leg. And that's like a small tube from a superficial vein in the leg that's sort of an accessory vein, and use that as the conduit or the piping, if you will, to do the bypass. And so it will open the chest and then place the patient on cardiopulmonary bypass just so we can do the procedure, and then just take each artery one at a time and go above and below the blockage, whether there's 3 bypasses or 4 bypasses, and then resume flow to the heart. So it's really something similar to plumbing, but it's just biological plumbing.
So you're a plumber?
Yeah, biological plumber.
Well, most plumbers get paid probably better than you. But anyway, does it matter how many bypasses that you have? Some people say, well, I had a double bypass, I had a triple bypass. What does that mean?
That means the double would be obviously 2 bypasses, the triple 3. Actually, statistics are the same. The mortality and complications are the same whether it's 1 bypass or 4. So it's not more serious to have 4 than it is 1, because that 1 might be very, very important.
Now, after surgery, of course, you go to ICU. Then what happens? What's the recuperative time for bypass surgery?
Most patients are taken to the intensive care unit straight from the operating room and on the ventilator for 3 to 4 hours, and then weaned off the ventilator. And generally, the next morning, they're up in a chair, taking liquids. It actually moves very quickly.
And during the bypass recovery time, is there any type of rehabilitation or cardiac rehab that patients undergo?
They do. They see physical therapy and cardiac rehab nurses actually the day or 2 after their bypass, and start exercising. And usually by the time they go home, they're ambulating in the hall, probably taking a shower, dressing themselves, recovery fairly quickly.
The average amount of time before that someone has a bypass and they can return to, say, a office job is about how long?
I would say probably 4 weeks. Somebody does heavy manual work, maybe 6 to 8 weeks. Most patients could resume some kind of light driving in 2 weeks, just if they were careful. So it's fairly rapid recovery.
Do many people have to ever have a second bypass surgery, or is usually nowadays one does the trick?
The operation is really not curative. It's not like taking your appendix out and you never have obviously never have an appendix. This is really a procedure just like maybe cleaning your sink out, the sewer or your sink pipe. It could block up again, but I think today's medical treatments with statin drugs for cholesterol, aspirin, certain medications, beta blockers, and of course exercise, the progression of the atherosclerosis is much slower than it once was. And so we do redo operations, but many of those patients are patients that continue to smoke or resume smoking, and those patients are more likely to have a second operation.
So it's very important, even though you get a bypass, it's still important for you to continue to watch your cholesterol, your weight, and exercise so you don't have progression of your disease. Well, thank you, Dr. Gooch.
You're welcome.